Hello, my name's Teresa Fergala, and I'm the clinical pharmacist for the respiratory program at West Park Healthcare Center. I'd like to talk to you today about the medications that we use to treat lung disease. Studies show us that only about 50% of us take our medications as directed every day. Knowing your medications, the way they work, and their possible side effects will help you understand the benefits of therapy and help you manage your lung condition. We can talk about your medications in groups based on how they work. The first group is bronchodilators. Bronchi means lung and dilate means to expand. So we're going to talk about a group of drugs that will open up your airways, making it easier for you to breathe. Anti-inflammatory medications reduce the inflammation within your lungs, often associated with lung disease. And lastly, we're going to talk about antibiotics that we use to treat acute exacerbations. There are three types of bronchodilators that we commonly use: beta agonists, anticholinergics, and theophylline. It's not important that you remember these names, just to understand that these medications act differently and therefore they will have different side effects. Also, there's a benefit in using drugs that act by different mechanism of actions because when we use them together, we often get a greater overall effect. Beta agonists are available in two different formulations, a short-acting and a long-acting form. Salbutamol or Ventolin and Bricanyl are examples of short-acting bronchodilators and are often referred to as rescue inhalers. If you're experiencing shortness of breath, it will be relieved within approximately 3 to 5 minutes, and it's usually recommended to take 1 or 2 puffs every 4 to 6 hours as you need it. When using Ventolin, it's important to know that you should wait approximately 30 to 60 seconds in between puffs, because that's the length of time it takes the canister to repressurize, providing a full dose with the second puff. Ceravent, Oxys, Ombres, and Fortaril are all long-acting beta agonist bronchodilators. Now, if you think of a day when you had increased difficulty breathing and maybe you needed to use your Ventolin inhaler more than 3, 4, 5 times in a day, you may recognize some of these side effects. Some of the side effects that patients describe with increased use of Ventolin are palpitations or rapid heartbeat, feeling irritable or anxious, and a tremor or shaky hands. The next group of drugs is called anticholinergics, and they are also available in a short-acting and long-acting form. Ipratropium or Atrovent is a short-acting bronchodilator that provides relief in about 15 minutes and lasts about 4 to 6 hours. It's also considered to be a rescue inhaler and is sometimes used along with salbutamol to provide relief from severe shortness of breath. There are now 5 types of long-acting anticholinergics inhalers available in Canada: Spiriva HandiHaler, Spiriva Respimat, Incruzalipta, Sebree BreezeHaler, and Tudorza Genuair. Spiriva HandiHaler is most commonly known, has been available for the longest. All 5 are felt to be equally effective, and the most important difference is the type of delivery device, as you can tell from the names: HandiHaler, Ellipta, BreezeHaler, and Genuair. If you're having difficulty using your inhaler, I'd encourage you to speak with your doctor or pharmacist about changing it to a different delivery device. For example, some patients using Spiriva HandiHaler have found that they have trouble inhaling the dry powder from the capsule. In this situation, patients may be changed to the Spiriva Respimat inhaler that delivers a fine aerosol mist for inhalation. The side effects that you may have with these anticholinergic inhalers include dry mouth, constipation, and difficulty with urination. Dry mouth can be particularly bothersome, and it's difficult to relieve. Some tips are to rinse your mouth frequently with water. Sucking on a sugarless candy can help stimulate salivation. And there is also a preparation called Biotene, which is available over the counter as a mouthwash, oral spray, and toothpaste. Many patients find it helpful to relieve dry mouth, especially when used at bedtime. There are many new combination inhalers available. Combivent Respimat is a combination of 2 short-acting bronchodilators and can be used to treat severe shortness of breath. The newest group of inhalers contain 2 types of long-acting bronchodilators, and shown here are Anoro Ellipta, Duoclear Genuaire, Inspiralto Respimat, and Ultibro Breezehaler. These are good choices for patients who require bronchodilator therapy without an inhaled steroid. Now let's talk about anti-inflammatory medications. Inhaled steroids and oral steroids are used. And unlike bronchodilators, which provide immediate relief, steroids improve inflammation over a period of time, not immediately. Our steroid inhalers include Alvesco, Asmanex, Flovent, Pulmicort, and Qvar, as shown here. In COPD, a steroid inhaler is always used in combination with a bronchodilator. This combined treatment helps to prevent exacerbations and also helps to reduce the symptoms of shortness of breath for you. But to be effective, the inhalers need to be used correctly and on a regular basis. Here is the group of inhalers that contain a steroid and a bronchodilator: Advair Discus and MDI, Symbicort Turbuhaler, Breo Ellipta, and Zenhale MDI. Advair has the advantage of being available in both a discus and MDI type inhaler. The Advair Discus is a dry powder inhaler, and when you inhale quickly and deeply, the powder is delivered to your lungs. For patients who have difficulty with this technique, the MDI puffer, which forces the powder into your lungs, may be used. Symbicort Turbuhaler is a dry powder inhaler that's used twice a day, and recently Breo Ellipta, which has the advantage of daily use, has become available. Zenhale is available as an MDI device. So it's generally felt that all the inhalers in this group are equally effective, and that the choice between the different types of inhalers helps your doctor find the right type of delivery device for you. The side effects that we see with the inhaled steroids are caused by the steroid powder remaining in contact with your mouth and throat tissue for a period of time. This can cause side effects such as sore mouth, hoarse voice, or a mouth infection called thrush. These side effects can be reduced by rinsing your mouth with water after using a steroid-containing inhaler. And if you're using an MDI type of device, such as Advair MDI or Zenhale, adding an aero chamber helps direct the powder into your lungs so less remains in your mouth and throat area. Now, if you're using more than one type of inhaler, you may be wondering which one to use first. When in using a combination of a long-acting bronchodilator, such as Spiriva, along with a steroid inhaler, such as Advair or Symbicort, Breo, or Zenhale, you should use the Spiriva type first. The theory is that the bronchodilator will open up your airways, allowing the medication from the combination inhaler, such as Advair or Symbicort, to get deeper into your lungs. What about the time to wait between puffs? As I mentioned, we recommend 30 to 60 seconds between puffs if you're using an MDI inhaler such as Ventolin, Atrovent, or Zenhale, and about 5 minutes in between inhalers. Now let's talk about some of the pills that we use to treat lung disease. Theophylline is an oral bronchodilator, and it's used as an add-on medication in patients with moderate to severe lung disease needing additional measures to help with the shortness of breath. It's available as Theodur, that is used twice a day, and Unifil, that is used daily. Theophylline are used with care because of their side effects and also because of their many drug interactions. Common side effects include headache, poor sleep, and anxiety. It's important for patients who are taking theophylline to speak with their doctor or pharmacists if they notice side effects such as nausea, vomiting, or any changes in their heart rate. Theophylline as a group can interact with many medications, causing serious side effects. For example, when theophylline is combined with ciprofloxacin, which is an antibiotic that we sometimes use to treat an exacerbation, theophylline drug levels can increase, and the risk of serious side effects also increases. An exacerbation is suspected when a patient experiences symptoms such as feeling unwell, increased shortness of breath and cough, and a change in sputum. It is treated with prednisone, which is an oral steroid, or with a combination of prednisone and an antibiotic. Prednisone is available as a 5 and 50 milligram tablet. When it's used to treat an exacerbation, it reduces inflammation in the lungs, making it easier for you to breathe. The dose can vary between 30 to 50 milligrams daily for 5 to 10 days. Take your prednisone exactly as prescribed, and you should never stop taking it suddenly without checking with your doctor or pharmacist. Prednisone can cause many side effects depending on the dose prescribed and the length of time you were taking it. It's important to balance the benefits of the prednisone with the risks. Some of the side effects that you may experience when taking prednisone include fragile skin, resulting in bruising or poor wound healing, weight gain due to fluid accumulation and increased appetite, weakening of the bones. While taking prednisone, it may be recommended to you to take vitamin D and calcium supplements to protect your bones from osteoporosis. Prednisone doesn't cause diabetes, but especially with high doses such as 30 to 50 milligrams, it can cause blood sugars to increase. And if you're diabetic or pre-diabetic, I would encourage you to check your blood sugars more frequently while taking high doses. It's best to take prednisone in the morning with food to reduce the risk of upset stomach and also to reduce the risk of poor sleep. When you have an exacerbation and experience a fever, a change in your sputum, an antibiotic may be added to the prednisone. And we can group the antibiotics that we use into families: quinolones, erythromycin, penicillin type, and sulfonamides. And you will see examples of these on this slide. It's important to reduce the number of exacerbations that you may experience. And one of the strategies that your doctor may use is to prescribe azithromycin daily, or perhaps 3 times a week, to prevent frequent attacks. Taking your medication is important, and I hope that the information in this presentation will help you understand your medications better and help you manage your lung disease. If you find that you have any difficulty taking your medications on a regular basis, I encourage you to speak to your pharmacist to help you. I hope you've enjoyed this presentation, and I thank you for your time.